And thanks to you at home for joining us this hour. Okay, our lead story tonight is an exclusive. You will not hear this story anywhere else. And to get this story this week, we sent some producers from the show basically to the end of the world. Technically, we just sent them to the end of the country. We sent them to the Rio Grande Valley at the tippy toe of Texas. This is part of the country that is so far south, it is south of Mexico. If you want to get to Chihuahua or Nogales or Tijuana in Mexico, you go north from the Rio Grande Valley in Texas. And it's a really big place. You know how people say that the state of Texas is about the size of France? Well, the Rio Grande Valley alone is about the size of the state of Connecticut. It's just a huge, huge place. And when you're there, you are kind of far removed from not just the rest of the country, but the rest of Texas. You're not near anything else. The Texas city of San Antonio is 250 miles away from the Rio Grande Valley. It's not an everyday trip. The Rio Grande Valley is remote, and it is beautiful, and it is very, very poor. The four counties that make up the Rio Grande Valley are all quite profoundly poor. The two biggest cities there rank first and second for poorest in the nation. Along with that remoteness and that poverty come health troubles. Preventable, treatable diseases at rates that do not seem like they should happen in the United States. For example, women who live on the Texas border are a third more likely to die of cervical cancer than women in other parts of this country. Poverty has its own health risks, and in far South Texas, those risks are compounded by it being hard to access medical care there. And in the year 2011, Texas Republicans made that uphill fight even more uphill. They cut state funding for health clinics that serve women specifically. And they didn't just trim that funding, they basically got rid of it. They cut it by 2/3. To be clear, these were not cuts in abortion services. These were cuts in everything else, in preventive care and cancer screenings and birth control. The effect was immediate. Dozens of family planning clinics closed right away. And because so many women lost access to birth control, which people tend to get through clinics like that, because so many women lost access to birth control, the state of Texas saw a rise of almost 30,000 unintended pregnancies over what they would have expected had those clinics been able to stay open. 30,000. Texas is having an unplanned pregnancy baby boom, not because of the end of a war or something, but because of the end of birth control. And not everybody who got pregnant without wanting to went ahead with the pregnancy. The following year, University of Texas study found that nearly half the women who ended a pregnancy in Texas that year said they had been unable to get the contraception that they wanted to use. But birth control is apparently a problem now in Texas. And Texas Republicans were so bent on not spending anything for family planning that even with the cuts that shut down those dozens of clinics, they held back even the little bit of state money that was still left. They left more than $2 million just sitting there in the account that used to pay for those services, while dozens of clinics turned off the lights and Texas women stopped getting cancer screenings and preventive care, and tens of thousands of Texas women got pregnant when they did not want to, because they lost access to the kinds of contraception that they used to be able to get through health clinics. What Texas Republicans did to health care, specifically for women in that state, was kind of a policy debacle on a national scale. Just embarrassing, even for Texas. In 2013, Texas Republicans brought some of that funding back. But for a lot of the clinics and a lot of the women, it was too late. In the Rio Grande Valley, specifically, they lost 9 clinics. More than 1 in 4 of them shut down. And you can still see that damage today. This used to be a family planning clinic in the border town of Brownsville, Texas. This particular clinic belonged to Planned Parenthood. They used to hold open days, kind of festivals in the parking lot for neighborhood women in Brownsville. So come by, we're in the neighborhood, get your checkup, find out about birth control. It was a neighborhood place, very open. It was their place. And then Texas cut the funding and their place closed. While our producers Laura Conaway and Kate Osborne were in Brownsville, Texas this week, they introduced us to Paula Saldana, who worked at that Brownsville clinic, teaching women about birth control, until the budget cuts forced that clinic to shut down and lay off people like her. But the amazing thing about Paula Saldana is that even though Texas lawmakers effectively ended her job, she kept going on with her work. Watch.
There's a lot of places that talk about diabetes, the importance of eating healthy, exercising, but yet nobody wants to talk about reproductive health. And I think that it's because it involves sex. And nobody wants to talk about sex. I do know for a fact that a lot of them would go to the clinic, get their services, they were super happy, but then when the cuts started happening, they panicked. They were worried. Where would they go now? Before, we had an option of going into Mexico to get birth control and things like that, but right now with the insecurity and things like that, there's no way we can go.
You mean the violence?
With the violence and stuff, yeah. After the cuts and after I was laid off in 2011, I just loved the impact the information would have on women. I like to see how they would react and learn and about their bodies, about the anatomy, that I decided to continue doing it, even if I wasn't getting paid.
Pretty much every day now, Paula Saldana and her volunteer colleagues, they're not being paid. This is not a job. But pretty much every day now, they are holding community meetings in and around Brownsville, where they're teaching women about birth control and how to take care of themselves. And she let us come along to one of those meetings in her town. And you can see the women gathered around on the patio, and they're singing, and they're playing bingo, they're playing games, and they are getting information about family planning, information that used to be available to them at that local clinic. They learn how to take care of themselves and each other, but they also learn how to watch out for their political interests.
We find this hard-to-reach women that would normally not even stick their nose out the window. We knock on their door, and I've seen the transformation on how we start giving her a pep talk. We tell her, you know, you're an advocate because you advocate for your family every day. And then we start softly talking about leadership skills. We empower her, we organize her. And by the time you know it, she's out there talking to political leaders, asking for change.
So it starts out being about healthcare and understanding your healthcare needs and making your own decisions about your health and whether or not you get pregnant and what happens if you do get pregnant. But getting information about those things and taking control of those decisions for yourself isn't just a health outcome. It's about power, right? It's about agency, sticking up for yourself and not getting pushed around or getting taken advantage of, speaking for yourself. The fact of these women as a political force may not yet be apparent in the Texas state capitol, but block by block, person by person, they really are building their part of the new Texas, hand to hand, right there on the backyard patios of Brownsville. And that is not all the news from the Rio Grande Valley. We actually have some news to break here tonight. If you look at the map again, you can see Brownsville, see there on right on the border, hard on the border with Mexico. Half an hour north is the city of Harlingen, Texas. And in Harlingen, Texas, that's one of just two places in the whole valley where you can get an abortion. That clinic is run by a guy who you do not want to push around. He's a don't mess with me Texas doctor named Lester Minto. Dr. Minto gets so many death threats because of his work that he carries a pistol and he wears a bulletproof vest. They're part of his daily carry, his daily routine for getting dressed for work. On top of cutting all the clinics funding in 2011, Texas Republicans passed a sweeping new law last year designed to close most of the abortion clinics in Texas. When that happened, Dr. Minto told the local paper in McAllen that the law was an insult to women's intelligence, in his words. He said he would, quote, continue to perform abortions, whether that means under the cover of a mesquite tree, on a shrimp boat, or going to Mexico. I didn't say I'd stop doing abortions, he said. I'm not going to give this up. I'm not going to abandon these girls. The first part of that new anti-abortion Texas law requires that any doctor who wants to provide an abortion in Texas, they have to get admitting privileges at a hospital near to where they're going to be providing that abortion. And Texas hospitals are not exactly eager to hand out admitting privileges, let alone to doctors who do abortions. And so Dr. Minto has not been able to get those admitting privileges. And so Dr. Minto has not been able to perform abortions at his clinic since November. Instead, what he's been doing is he has turned to helping women who have been trying to end their own pregnancies on their own without a doctor. South Texas women have been crossing the border to go to Mexican pharmacies to buy drugs to self-induce their own abortions. or they've been buying those same drugs on the local grayish black market at flea markets. And when they run into trouble because they had no doctor when they self-induced their own abortion, when they run into trouble, they come to see Dr. Minto. And that has been his work since the new Texas law went into effect in November, which stopped him from providing abortions. Instead of safely providing abortions, he has just been trying to save women who have been trying to do it to themselves. And now, tonight, we can tell you that he will not be doing even that anymore. We spoke to Dr. Minto this week, and he told us that today, Friday, February 28th, he has closed his clinic forever. He closed it today. He says he's never been a rich man and he cannot afford to keep going. He has now put his building up for sale. He's turned his last patients away. He told us this tonight, quote, "It's heartbreaking. It makes me want to cry. It's my life. I'd a whole lot rather be helping women, but Texas has made it impossible. I just think it's so sad in Texas how little respect we have for women." And just like that, this already isolated and poor border region with really poor health outcomes, just like that, they've lost one doctor, one more place for women to turn. Not because women do not need or want the help, but because the state of Texas has legislated that help off the list of possible choices. We're going to have more reporting from Texas and the Rio Grande Valley next week. We've got a story coming out of there that is more amazing than this one that we were able to tell tonight. It is an amazing place that is in the middle of an amazing fight and an amazing story. And we're going to be right back.